Hello, Kinesiology 3010, and welcome to our first digital lecture. For this digital lecture, we're going to go through Chapter 1. I do recommend you go through the textbook and read Chapter 1 before you move forward with your labs or move forward with anything else in the class. I recommend reading the text and then watching the video lectures, and then going into any assignments or quizzes that you have for the week. Remember, you can find all of your information on Canvas as well as on the syllabus. Okay, so today we're going to talk through some of the major key points for measurement and evaluation. First one being measurement, going through tests, different standards that we use to evaluate, and other evaluation styles like summative and formative evaluations. Measurement is the process of assigning a number or a value to the performance or to an attribute of a person. Especially in kinesiology, we'll often use performances or physical attributes or cognitive attributes of a person. And we'll give them or assign them a number to compare or to use in any of our evaluation tools that we're going to use, either statistical or comparative. Okay. Some examples would be, say, if we're looking at upper body muscular endurance, we could use the push-up test. Okay, the push-up test, or as many push-ups as you can do in 1 minute. And that number that you achieve would be assigned to your individual or towards you as your upper body muscular endurance value. We can compare that to different tests or associate that to other measurements to see what's changing, or if different things are related, or if different conditions are different, what happens when you're tired, what happens if you're trained or untrained, and we can compare those using these measurements. Okay, if we want to look at something maybe in the capability of knowledge, we could use our midterm assessment in this class is a measurement of your knowledge in measurement and evaluation. So your midterm exam, the number that you score correct, your score is a measurement of your knowledge within the subject matter. Okay, that's why we use tests when it comes to academics. It's to assess or measure your knowledge or your understanding of the material. The test is slightly different than the measurement. The test is the tool that we use to collect that information or to create the measurement or to allow for the measurement. So if we're looking at how far you can jump, our test will be or will involve our measuring tape and you jumping. So we're facilitating that measurement through an instrument or a tool, in this case a tape measure. Some of these tests can be written, so a knowledge test or a motor skills test, looking at how well you can serve a tennis ball. Looking at other psychological or physical tests, if we're looking at a physical test like the 1 mile run, that 1 mile distance will be our test, along with our tool, the stopwatch, to see how fast you can complete that distance. Evaluation is our interpretation. So now that we have measured or tested what we're trying to measure, we now evaluate or interpret or give a judgment to those measurements or those numbers, those values. So we're looking at what's good, what's bad, what's worthy, what's different. And we're evaluating that information and giving it meaning. So we're taking those numbers and giving those numbers meaning or value. Okay, so why do we have to do this? Okay, we maybe needed to make a decision or to make judgments based on those measurements, or to just give more meaning to that data that we collect, because we can collect a lot of numbers, especially with all of the new technology that we have now. In different fields of kinesiology, we can accumulate a lot of data, but we need to evaluate that data or give it meaning. Okay, so most numbers don't have much meaning unless we reference it to something else. So if I give you the example of you can do 14 push-ups in 1 minute, is that good? Okay, how do we know? Is it good? Is it bad? What about for a 12-year-old girl? Would that be good? Or what about for a collegiate male swimmer? Would that be good? They're the same number, but we're giving a reference, we're giving some context to the information. And maybe if we compare that to a 75-year-old or to you, is that good? Is that bad? What are we referencing it to? Okay. That reference could be, a reference itself is a standard that we compare our measurements to. So a norm reference standard would be compared to what is normal within a group, or what is average within a group. So within all 12-year-old females, 14 push-ups is above average. Okay, or among all male collegiate swimmers, 14 push-ups in 1 minute is extremely below average. Okay, we can compare them within a specific group compared to what is normal in that group. So we use this norm reference standard for things like height and weight. What's normal height, what's normal weight at different ages. Okay, comparing all individuals at the age of 10, what is normal or what is average, what's in the middle compared to, and looking at, okay, are you below average, are you above average, are you within what is normal for this group. You maybe remember any President's Physical Fitness Test back in elementary school, middle school, or high school. Those are norm reference tests. So we're looking at what is normal for the population, what is normal fitness for a 14-year-old male or a 14-year-old female, and comparing each individual on that norm scale, or what is normal for that group. Okay, with a Criterion-Referenced standard, this is a little bit different. These are predetermined standards, so these are set in stone. These are an actual number that must be achieved, or measurement that must be achieved to be good, or to be below average, above average, or not really above average, but within good, bad, better, best. You have to reach a certain criteria that's been predetermined or is already available to you. Okay, so some examples here, like the fitnessgram test, we have a set number for if you don't achieve this score, you are not fit, or if you achieve this score, you are fit. Things like a driver's license test. Okay, if you don't achieve 80% correct answers, you don't pass. Or if you look at this class, Kinesiology 3010, we use a Criterion-Referenced standard. You have to achieve at least 70% of the course to get a C- and to pass the course. If you don't achieve 70% of the content, you don't pass the course. Okay, that's a criterion for passing the course, would be that 70% mark. Or if we're looking at things like how to be physically active, if we use steps per day, we have individual standards. You have to get greater than 10,000 steps per day to be categorized as active. We'll often use these criterions for specific categories so that we can compare groups along this set scale. So someone who is getting between 7,500 to 9,999 steps is somewhat active. They fall into that category because they reach that criteria to fit in that category. Okay. So let's kind of review a little bit of this. What are different standards, and how do we use them? Okay, so I want you to pause. I want you to go back through your notes. I want you to go back through your textbook, look at norm reference standards, Criterion reference standards, and I want you to kind of go through a, not a pros and cons, but go through a kind of a Venn diagram style. What is each, and what is some similarities between each? And then think about what would you like to use? Okay, so what would you prefer in Kinesiology 3010? Would we want a criterion, or would you maybe want to take this class into a norm reference standard? So I take everyone's score at the end. If you achieve average, you pass. If you're below average, you don't pass. That would be using a norm reference standard. So if you achieve, say, everybody achieves, or the average is 70%, everybody below 70 doesn't pass, everybody above 70 passes. or if everybody gets or if there's an average of 80%, everybody who gets 80 or above passes the class, less than 80 doesn't pass the class. So you're compared to your peers within that group compared to a Criterion-Referenced standard where we have a set value that you must achieve regardless of what anyone else within that group achieves. So there's pluses and minuses to each, but it really depends on where we're using them, what's the context. I want you to think about some of these examples within daily life. Okay, things that you may have seen, especially in kinesiology, things like body mass index, blood pressure, cholesterol levels. Are these norm referenced or are these criterion referenced? So pause for a second, think, what do you think each one is? Okay, BMI, we use a criteria. So you must have a BMI between 18 and 25 to be considered normal. Okay, you must have between 25 and 29.9 to be overweight. Okay, you have to be in that criteria. You have to meet that zone to fall into that category. Regardless of what someone else is, if the average population BMI is 25, that doesn't make that normal. Okay. Or if the average population is 27, that doesn't make 27 a normal BMI. It's still an overweight BMI. Blood pressure is also used on a criterion scale, so less than 120 over 80 is considered normal. Okay, regardless of what the average in the population. If the average of the population is 140 over 90, which is hypertensive, that doesn't make hypertension normal. Okay, it's normal is within that standard. Same for cholesterol. We have these specific criteria that must be less than 40 milligrams per deciliter or less than 100 milligrams per deciliter. To fall into these low, normal, optimal, good, into these different categories for our evaluation of these individuals. Okay, so when should we evaluate people? When should we make judgments? When should we make our statement based on value or worthiness of these measurements? And we can do things that are like a formative evaluation. So this is an initial or a beginning or a pre-assessment or a pre-evaluation. It's a good tool for feedback. It gives us an idea of what's going on now at the start or at the beginning. If you're going to the clinical field, you'll often do formative evaluations on your clients or your patients right when they come into your clinic. So for example, we have an individual who had a shoulder surgery, and your goal for your patient is to regain range of motion at the shoulder joint. So you have to assess initially what their range of motion is at the start so that you can determine if there's change or how much change is necessary, because we understand where we're starting. Okay. If we're looking at a summative evaluation, this is kind of a final evaluation or a terminal evaluation. So think of this as like your final exam or a post-test after your intervention. Maybe you're a physical therapist, you were giving an assessment, you gave your formative assessment, and then after 12 weeks of your intervention or of your therapy program, you perform a summative evaluation before your patient leaves to see if they achieved the standards that you set or the change that you wanted to see. Okay, some examples here, maybe you have a middle-aged man with diabetes and obesity, and he said, or his doctor tells him he has to lose 25 pounds and decrease his body fat down to 20%. Okay, somewhere within that normal, healthier range compared to someone with diabetes and obesity. Okay, so you perform a 6-month plan. At the start, you're checking where they are. This is your formative evaluation. Okay, and then at the end of that 6 months, we measure the same measurements, or we perform the same tests, so body weight, percent body fat, to see if there was change at the end within that summative evaluation. So formative evaluation at the start, at the front, and summative evaluation sums everything up, it's at the end. Okay. So why should I do all of this in the first place? Why does any of this matter? Okay, the purpose of testing and measuring can be for different reasons. Maybe it's to place individuals in groups, like your different BMI groups. Maybe it's to diagnose an illness or an injury. If we have, maybe if you've lost any range of motion or a specific amount of range of motion, maybe at the wrist joint or at the knee joint, we know that there is a problem because we've measured, tested, and evaluated based on those measurements. Maybe it's based on motivation, knowing where you are and then seeing where you could be, could give motivation. Maybe for your clients, doing a pre-test can show them where they are and can motivate them to create change. Maybe it's for achievement. You're doing a post-test or a summative evaluation to see if you've achieved the goal you set out to achieve. Or you do that within your own program or your own creation. Maybe you are a strength and conditioning coach and you look at your entire program after your year to see if you reached the goals that you were trying to reach with your athletes. Okay, so we would have to first create measurements, tests, and then evaluate those to see if we achieved those goals or see what happened over that time period. When it comes to placements, we often do this with different sports or different classes, with like swim class, or if we're looking for varsity JV, we have our athletes or we have our individuals. We're going to test their ability or do a formative evaluation of where they stand now. If they reach the standards or the criteria we set, they would fall into those groups. So maybe if you are better than average on your team, you go to varsity. If you're average, you go to JV. If you're below average, you go to frosh off, or however that may fit. Or maybe with your swim classes, you have beginner, intermediate, and advanced. And they have to reach a certain criteria of skill that you set at the start for them to fall into each of those classes or those groups. Okay. When we're looking at diagnosis, maybe we're looking at weakness, and maybe we're looking at stress tests. Okay, if you're doing a stress test as a cardiologist, and you want to know if your individual has cardiovascular disease, we have standards set that if they achieve a certain heart rate at a specific level of the stress test, or if they fail the stress test before a certain level, we know that there are issues because we now have a measurement. We're giving the value, their score on the test, the stress test, and evaluating it based on what is normal for a healthy heart and what is normal for a diseased heart. Okay, if we're looking at things like predictions, maybe our goal is to see if we can predict what may happen based on information we already know or information we found in the past. So maybe we're trying to predict if increasing physical activity will reduce cardiovascular disease, based on individuals who are more physically active compared to those who aren't. We see that those are more physically active have better markers of health. Maybe we can predict that a certain amount of physical activity can help prevent heart disease. So maybe we use this data to give us ideas of prediction in the future. We're looking at it when in the context of motivation. Maybe we're trying to lose weight. Maybe we have a group that wants to lose weight or control their body weight. Knowing where they start, maybe they say, okay, we're here. We are 5-10 pounds overweight or over our goal weight. And then over the course of your intervention, every week you measure their weight and you evaluate based on their pre-test if they've changed. And then you can motivate them. Oh, we saw that we lost 2 pounds this week. And that could be motivation to maybe stick to the program, make new changes, or improve their life in a different way. Okay, when it comes to achievement, okay, maybe you have to achieve a specific level to continue on, like within your education. You have to achieve a passing grade in kinesiology 3010 to get your bachelor's degree in kinesiology from Cal State Bakersfield. Okay, that standard is based on our measurement, your knowledge, the test your assessments within this class, and then that grade is compared to our standard to see if you pass the class and can continue on, that you've achieved the requisite knowledge to move forward with your degree. And then we can do this things with program evaluations. You can do this maybe if you're in the private fitness center or private fitness facility, and you're looking at your memberships and your membership retention. You can see where you started. If you've changed over the months, if you see that your enrollments or your sales have gone down, you know that your program is not doing well and you need to make some kind of change or intervention to improve that program. But without those tests and measurements and without evaluating them, you would never know that there was a problem. Okay. When we go into human performance, sometimes we'll look at more psychomotor or more cognitive aspects or affective. So if we're looking at psychomotor, we're looking at skills and motor control. Cognitive, we're basing that around knowledge. Okay, so think of psychomotor as skill, fitness, performance, cognitive as knowledge and understanding, and affective as psychological, emotional aspects within human performance, or we can think of these within the realm of kinesiology. Okay, so we first start, this is kind of our tree to how we evaluate. Okay, we have to decide what we're going to assess or what we're going to measure. So are we looking at some psychomotor component, like maybe someone's skill at playing tennis? Okay, and then we need to test that with a measurement. We need to find the objectivity, reliability, relevance, and validity of that measurement. If it fits, we can use it, and then we evaluate it based on maybe a criteria or what is normal. Okay, so we'll go through this throughout the semester to determine how we're going to create our studies, how we're going to evaluate other research studies that we're going to read, and look at each of these different components. Okay, so just a review, I want you to go back through your notes and make sure that you can, on your own, in your own words, describe measurement, describe test, describe evaluation, norm referenced and criterion referenced standards. Hint, hint, these terms might be on your quiz number 1, that's going to be in week 2, so hint, hint there. And then we'll close it out with a quick example. Okay, so I have a situation here for you, and I want you in this process, I want you to find where the measurement is, where the test is, and where the evaluation is. Okay, so take a second, pause the video, and I want you to go through, read through this situation, and determine where the measurement, where the test, and the evaluation are. Okay, so pause. All right, hopefully you have paused, you've taken the time, gone through this, and determined where each of these components are. So we'll go through this together, and we'll go through exactly where these measurements, tests, and evaluations are. Okay, so in order to understand his student's skill level in tennis, a professor conducted a short survey by using a questionnaire in his class. After that, the professor used the statistical approach and found that 30% of the students ranked their skills as good, 30% as fair, and 40% as poor. Thus, the professor decided to assign the 3 groups of students to different tasks. Okay, where would be the measurement here? Okay, the measurement would be the skill level in tennis. Okay, the professor conducted a short survey using a questionnaire. That would be our test. Okay, so skill level in tennis is the measurement. We're trying to see what is skill level. A survey questionnaire is the test that we used to find that measurement. And then our evaluation would be the categories that we're going to give the students. So good, fair, and poor is how we evaluate them based on our test, based on the measurement that we're trying to see. We're trying to see skill level. Good, fair, and poor are the categories of skill within this situation. All right, thank you very much for watching. And then please go back through your book and then go through your assignments for this week. For week 1, you have lab 1 and lab 2. Lab 1 is a basic math skills lab. Okay, so a little bit of review of math. Please show you all your work on your assignment. And then your lab 2 is beginning our survey. Okay, so you're going to take a survey of individuals that you know and compile that data into an Excel spreadsheet. For our lab components next week, for our lab lectures, we're going to go through how to put that data together, and then you're going to submit that data within your following lab. All right, thank you very much, and enjoy the rest of your week.